Hi, welcome to Radiology Everywhere YouTube channel. In this video, we briefly discuss the differential diagnosis of posterior vertebral scalloping. Causes due to localized increased intraspinal pressure. Intradural spinal masses include ependymoma, astrocytoma, paraganglioma, neurofibroma, schwannoma, lipoma. Intraspinal cysts include dermid cyst and epidermid cyst. Causes due to dural ectasia. Neurofibromatosis type 1 with lateral thoracic meningocele. Hereditary connective tissue disorders like Marfan disease, Ehlers-Danlos disease. Osteogenesis imperfecta tarda, Loeys-Dietz syndrome. Congenital skeletal disorders like achondroplasia, mucopolysaccharidosis include Hurler syndrome, Morquio syndrome, acromegaly, communicating hydrocephalus, syringomyelia. If you liked the video, share it with your friends. Subscribe to the Radiology Everywhere YouTube channel. See you soon. Bye-bye.